one administrator calling this source of funding vital, with any major pauses or cuts to it could lead to delays in research.
We are definitely a global leader.
Francine Jackson has worked in North Carolina's life sciences field for about a decade.
The answer to any medical question is, can you do it? And the second one is, how fast? And to move things to the pipeline does require funds.
The National Institutes of Health is a government agency which provides federal research grants, broken up between direct and indirect costs. The direct costs go towards research, salaries, and equipment, while indirect costs are for facilities, student services, and building expenses.
Everything that touches that research, for then it to be turned into the pipeline where a drug can then be marketed out to the public. There are a lot of other ancillary but very equally important parts.
Universities have long negotiated a rate with the federal government over coverage of those indirect costs. For UNC, it's 55.5%. At Duke, it's 61.5%. The White House wants to cap that at 15%. In a post on X, NIH wrote that 15% is above what many major foundations allow and would save more than $4 billion a year effective immediately.
Without that funding, especially in such an immediate sort of timeline or response following from the recent events, would put us in pretty dire straits.
Last year alone, Duke was awarded over $580 million in NIH funding, money which over the years has gone towards research in everything from cancer to Alzheimer's to vaccine development.
It would have an impact on all of that research to be performed. We'd be looking at trying to save dollars in areas that are cheaper research, and that's not really the way we should be thinking about research.
Down the road, UNC Chapel Hill was awarded more than $531 million from NIH in 2024. Dr. Holden Thorpe formerly served as the school's chancellor and is now the editor-in-chief of Science magazine. He said if the cuts hold, it could have a staffing impact at the university on scale of the 2008 financial crisis.
So I think there's a lot to worry about our international competitors and about our talented people going to other countries to do research.
All three also noting the ripple effects this could have, particularly here in the Triangle. We've documented the growing life sciences industry, many companies pointing to the talent coming from those universities, the research at those universities as reasons why they've opened up or expanded operations here. Now, we mentioned that lawsuit spearheaded by attorneys general off the top of this story. There's another lawsuit filed today by more than a dozen universities and educational associations against NIH and DHHS. At 6 o'clock, we'll share details on the impact they say those cuts could have on their operations. In Raleigh, I'm Michael Perchik, ABC 11 Eyewitness News.